Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Hello, everyone, and welcome to a special episode of Nurse Converse in partnership with Emory University. My name is Raquél Pérez. I'm a NICU nurse, entrepreneur, and host of today's episode. Today's topic is all about data science and its power in healthcare, and here to help me speak on that topic, I'm joined by Jacqueline Nickpour and Jane Chung. Hi, ladies. It's great to have you, and thank you for joining. I'd love to start off by letting the audience know a little bit about each of you. So, Jacqueline, could you kick us off with one or two sentences about who you are and what you do?
Sure. Thanks so much for having me, Raquel. I am Jacqueline Nickpour. I'm an assistant professor here at Emory in the School of Nursing. And I characterize the work that I do as a researcher as sort of at the intersection of nursing care, health policy, and health equity. So I'm really interested in studying models of nursing care, especially in community health settings that use nurses to the fullest extent of their education and training and think about how we can kind of leverage nursing care to achieve equitable health outcomes and better value.
Love it. Thank you. And Jane, if you could introduce yourself.
Sure. It's great to be with you, ladies. And I'm Jane Chung. I'm an associate professor in the School of Nursing at Emory University as well. I'm a nurse scientist and gerontechnologist by training, meaning that I do research in the intersection of aging and technology. So my research focuses on developing, applying, and evaluating various technology solutions to detect early signs of health decline and to promote healthy, independent living among older adults.
Awesome. Well, thank you again for both joining. You're both very accomplished women and leaders in healthcare. So to start us off, like I said in the intro, tonight's episode is all about data science and the power that it has in healthcare and specifically for nurses. So just to really give a basic intro, can both of you speak onto what data science is and how does it, at the very basic level, apply to nursing?
Sure. Probably I can start. So I just wanted to mention a couple of key terms here that might be relevant to today's talk. Those are big data, data science, and artificial intelligence, which are deeply interconnected. So big data science or big data refers to the massive data sets generated in healthcare, including nursing documentation, patient observations, and clinical records. And data science provides the tools and methods to analyze and make sense of this big data. And it helps uncover patterns and insights. And artificial intelligence takes this a step further, and using these insights to build predictive models, automate tasks, and support clinical decision making. So I would definitely start with these key terms.
Yeah, that's really helpful. Thank you, Jane, because someone like me who is not in data science every day, like both of you, or really connects it to nursing, I think that helps really break it down for the folks that, might be confused or really have first time hearing about data science. So thank you for that. And Jacqueline, curious about what your thoughts on how data science applies to nursing at the very basic level and what you do every day.
Great question. So I actually think of data science as similar to how I think about the practice of nursing, right? So not to go all totally nursing school on you, but I think about data science as generating evidence, especially through these really large clinical and administrative data sets like nursing documentation, billing records, all of these different tools and technologies that we have to generate evidence at a very large scale about what some of our best practices are, what treatments are most effective, how we can leverage different technologies to improve patient care. And if you think about it, at the very basic level, nurses are kind of at the micro level doing data science every day, right? So you can have a patient who you're doing your assessment and you have all of their labs and their imaging records, and maybe things are a little bit different. Let's say you cared for this patient yesterday and you're caring for them today too, right? Maybe their vital signs are a little bit worse, they're a little bit more hypotensive, but they otherwise their labs are fine, their images look good, but maybe they just don't quite look the same as they did yesterday. Maybe they look a little bit more pale, maybe they're a little bit more sluggish, a little bit slower to get out of bed. You might kind of take all of this data, right? Whether it's kind of the facts right in front of you, like their labs and their images, and you might take sort of some of the kind of less quote unquote hard data and put all these things together in the most complex computer that has ever been known, which is your brain, and think, okay, well, I think maybe something is a little bit off with this patient, and maybe I can't quite figure out exactly what it is, but you're dumping all of this information into your brain and using that to inform the decisions that you make, right? So I think of data science as complex decision making, whether that's on the micro level, like how a nurse would be doing in the day-to-day world, or on the macro level, which is a lot of, I think, what Jane and I do, which is using some of those large data sets to kind of generate evidence for a larger group of people about what kinds of care models and what kinds of treatments work under which conditions for which
Hmm.
patients.
That's really helpful. And actually, speaking about what you and Jane do on your day to day, I do kind of want to dive into that a little bit and ask both of you how you got into this field of work, because nursing is very diverse and there's a lot of ways that you can be a nurse and do a crazy amount of stuff as a nurse. How did both of you get into this aspect of nursing? And how do you feel that you're leveraging your career when it comes to data science in your day to day? Whoever wants to start.
Yeah, it's funny because I actually almost quit nursing school after my first week because I was like, I do not belong here. Everyone who's here has a very clear idea of what field they want to be in. Maybe they came from a family of nurses and they very much identified with a patient population, whether it be pediatrics, oncology, what have you. And I was never really that person. I kind of saw myself in nursing school as being more drawn to some of this more system level problems. Uh, a lot of that is informed by the fact that I grew up with a disabled parent as a caretaker for that parent, and sort of from a young age, and especially like growing up in the era of health reform, kind of saw a lot of the system level gaps in how we care for patients. And when I became a nurse, I started to see those same patterns, right? So I started my career at a large, well-known children's hospital, and I would see the same patients kind of get readmitted over and over again. And I sort of felt like there has to be a more system level way to keep these patients out of the hospital and to keep people healthy in their communities. And I kind of just felt like a band-aid. And so that led me to start getting really interested in policy, which led me to pursuing a career in research and using data to generate evidence that can drive changes in policy, whether that's at the level of a given hospital or a given health system or practice, or whether that's in larger scale changes in how we deliver and pay for
I
healthcare.
love that. With what you're doing today, what does a typical day look like for you in the work that you're doing? Because I'm curious, it's not every day that you come across a nurse who's in data science. And I'd love to know what your 9 to 5 or whatever hours it is looks like for you.
Well, my husband likes to say in academia, you can work any 7 days of the week you
Mm.
want, which is not totally untrue, but also I do think that every day looks a little bit different, which is something that I like. I think it's something that a lot of nurses like. So I mainly spend my time as a researcher. We write a lot of grants, and I write a lot of grants, and from those grants I'm able to purchase large data sets that I can use to study. For example, a lot of what I'm looking at right now is the role of nurses in primary care, and I can use some of that data, whether it's from a payer like Medicare or whether it's from a health system, to look at things like nursing notes in primary care, right? So nurses don't really bill for care. And one of the things that I'm really interested in doing is taking some of the notes that a nurse will write about a patient in primary care and using something like what's called a large language model, which is just a type of computer sciencey kind of procedure to analyze lots of textual data and come up with some of the conclusions or generate evidence about maybe what those lines of text are saying at a large scale, sort of synthesizing all of those notes and using that to say, okay, well, what value does a nurse have in primary care? A registered nurse or an LPN, not necessarily, we kind of know what nurse practitioners are doing, especially if they're billing for care, whereas for nurses, that's not really quite the same. So using a lot of that to say, hey, here's all the things that nurses are doing in primary care and in other community-based settings. Here's how they can potentially contribute to improving patient outcomes and potentially cost savings through reduced hospitalizations, things like that.
That's awesome. You're doing the work that I think a lot of people would not be doing, but it's very, very important. So thank you. And Jane, I'm going to ask you the same question. How did you get started in your career, what you're doing now, and kind of, what does your day-to-day look like currently?
So I started my journey in this field as a doctoral student. And at that time, I was interested in the ways to improve older adults' health, most especially in the community setting. So I was interested in prevention and risk assessment and risk detection. And for my doctoral work, I had a chance to work with engineering students and engineering faculty. They are electrical engineers and computer scientists. And based on collaboration between nursing and engineering, we conducted a project that involved several types of home-based sensors, like motion sensors to monitor your motions in a certain space in your home, and water consumption sensor that can monitor different types of water involving activities. So that will give you some ideas about how the older individuals spend time in their homes and what types of water involving activities they perform. And that gives us some ideas about the level of independence among these older adults. And at that time, I didn't know that these types of sensors could generate big data, I would say. And at that time, we didn't talk a lot about big data. But later, I realized that the type of research that I did generated a lot of big data. But anyway, so these data sets gave us some ideas about the level of independence and physical functions. And later on, so after this doctoral work, I continued to work on these sensors to find a way to accurately assess the level of physical functioning, cognitive status. And these days, I'm looking at the level of social isolation and loneliness, more of an emotional well-being type of thing. And in terms of how I spend my time as a researcher, many of the things are the same as what Jacqueline said. But as a community-based researcher, I would probably add that some of my work is related to testing some commercially available devices like wearable sensors like Fitbit watch, Garmin GPS watch, or Apple Watch as a health monitoring tool. And I'm using also the home-based sensors to detect motions, your sedentary behaviors in home, or how long you are sitting on a specific location, and what types of home-based activities you are doing. So many of my research relates to this device testing and putting them into older adult homes and let people use these devices or let them live with these devices for a certain duration of time. And this sensor system can generate some data, and we are going to work with some engineers and data analytics to dig deeper into what's going on in their daily lives to find a way to see the level of their functioning. So yeah, those are some of the things that I do.
That's very cool. Thank you for sharing. That sounds like a lot of fun, actually. What you were mentioning, I could see how like the processes behind a lot of health outcomes that we're doing and things like you mentioned, Fitbit, Garmin. I mean, those are everyday uses that people or everyday electronics that people are using. And I would never think that a nurse could have the ability to dictate those numbers or to be part of those processes. And I think it's really awesome and very cool work that both of you are doing. So to kind of switch gears a little bit, I do feel as though when nurses are presented with the thoughts of data or things like AI, there is a very visceral initial response, especially when it comes to the topic of AI and thinking about, will they be taking our jobs if AI is implemented in the nursing workforce? Or what are we doing wrong if we're using data more? I don't know, things of that nature. I feel like we kind of like panic plan when we hear about data and AI. So, from two people who work in it every day and are nurses, I do want to ask, what are we missing here in terms of breaking down data and AI so it doesn't feel so scary? And in reality, where do you both think that it could be beneficial to nurses, and how should our perspectives change in that regard?
Yes, I hear a lot of those stories and the fears from nurses or nursing students that I taught, or even from the colleagues, the faculty colleagues. So should we learn this data analytics or health informatics or nursing informatics? Should we teach this course to our students? That's one of the questions that I frequently had. And I said yes, because data analytics or informatics knowledge is one of the core things that you should know as a nurse or nurse scientist or nurse leader, right? Because many of the systems we use in the hospital, like electronic health systems or clinical information systems, are one of the critical technology systems that nurse engage with on a daily basis. And as a nurse, you should know what's going on, or you at least what I want to say is nurses should get involved in decision making about the adoption, implementation, and evaluation of these systems. Otherwise, these systems just get implemented into your workplace without your knowledge, with your agreement, and it will detect some of your work and it will impact your workflow. So at least you need to know what this system is going to do in terms of nursing practice and nursing workflow, right? So that's the basic or the rationale that I use. And I'm going to stop here. No, I'm going to add one more thing. But I stopped.
Okay.
Okay.
I'll pass off to Jackie if you also
Okay.
agree with, or not agree, but if you have heard the same rumblings about how AI could be scary when it comes to nursing or healthcare, and what you think our perception of it should be working bedside or in other fields of nursing.
Yeah, no, absolutely agreeing with everything that Jane is pointing out. And it's funny. I remember when I first started my career as a med surg nurse, I remember our EHR system at the time had this sort of clinical severity tool that was embedded into it. Now, this was almost a decade ago, so I can't remember exactly what it was called, but you would fill out like your whole patient assessment, and this tool was in a row at the bottom, and it would sort of automatically populate like a patient's clinical score, if you will, in that row at the bottom. And I remember, I think it was still in orientation, and I asked the charge nurse one day, like, hey, what exactly does this number mean? Because you could track it over time with each patient, and it was supposed to represent how sort of severe this patient was, or who maybe needed a little bit more closely monitored, or what have you. So I asked her, and there were really no parameters. I remember she said to me, the score itself doesn't really matter. It's about how much it changes either way, going up or down. And I had no idea even like what this tool was being based on or what the parameters were. Was a higher score, meaning that this patient was more clinically severe or more sick and needed more monitoring, or did a lower score mean that? Because I'd have patients who would have their scores be in the 50s or in the 70s, and I had no idea what that meant. And I share this because I think it's such a good example of some of these tools that use data and use AI to supposedly improve patient care, but they're designed without sort of the end user in mind. And really, the end user in a lot of these cases is nurses, because we get all of this data, we see all of these things that are coming in. But if you're in a situation like how I was in, where you have no idea how it's being used, then either one, it ends up just being a waste of time and money because you don't use it. You don't know how it is supposedly helping your patient or helping you do your job, or it ends up kind of contributing to, I think, what Jane is saying with this negative sentiment around data science and AI. So I absolutely understand why it's something that nurses are concerned about, maybe not being designed with them in mind or not being accurate. There's examples of tools with early recognition of sepsis or early recognition of deterioration that I've heard anecdotally and in some of the studies that have been published that a lot of times these are not really accurate predictors. And so again, it ends up just being all of this time and resources that are put into these tools that could be used to enhance patient care, but they're not, because they're not kind of keeping nurses' perceptions and nurses' needs in mind to sort of enhance their workflow or enhance the care that they're delivering. And so really thinking about, when we think about skills that nurses need, absolutely, I think we're kind of in this world where an understanding of at least what data science is and how you can use your nursing knowledge to improve care is such a fundamental skill. And I think offers an opportunity for nurses to become leaders in their own practices, right? If you are a nurse at the bedside and you see this problem, like let's say you're on a unit that gets a lot of CLABSI, central line associated bloodstream infections, or has a lot of falls, is there a way that you can maybe predict patients who are at risk for this? And how can nurses work with the people who are sort of developing these tools and integrating them into our EHRs, do so in a way that it's actually going to be clinically useful to nurses to improve care, identify patients at risk, all of those things that we all
Yeah.
want.
I'm glad you mentioned that, because I do feel like when it comes to the topic of data in nursing, it often feels as though that's something for other people to do. For example, I worked in the NICU for several years, and I also was a med-surg nurse for several years. And when, the topic of data or AI or research comes up, it never felt like that was something that I would own as with just RN next to my name. That feels more like management or researchers or scientists in a lab would be responsible for. But as both of you are talking, and as we've discussed before, it does feel much more tangible than I think a lot of nurses perceive it to be. And there seems to be like this weird misunderstanding, and maybe it's because it's not talked about enough, or I'll speak to just my experience. I don't really recall in nursing school ever really having a class about data science or informatics that would make it feel tangible in my day to day as a bedside nurse. So I'm glad you're both mentioning what you are, because I feel as though there is, again, this misunderstanding. And in reality, there's so much of the nursing experience that accounts for data in everyday use. So I just wanted to mention that for the listeners. I think so much of our work is intertwined with data, and we're not even realizing it, to both of your points.
Yeah, absolutely. And Raquel, I would add too onto your last question about the potential threat of AI and of data to nurses' jobs. And I want to be really clear, there is no AI tool or technology or data in the world that can replicate the human mind and sort of the nursing clinical judgment that comes along with our own human kind of processing of information and our own intuition and our own experience. Those things are not replaceable by machines. And I mean, I can't predict the future, but I can't imagine that we would ever be able to fully replicate the human brain in such a way that it wouldn't rely on, let's say, your own past experiences or your nursing knowledge, or maybe something that you've heard that you're seeing in a similar kind of case with a patient in front of you. All of those things are just not replaceable by any kind of AI tool. And I think that that's one thing that we need to keep in mind, is that these are all things that, when done well and done correctly, can absolutely be tools to improve patient care and improve patient outcomes and improve the efficiency of our healthcare system. But you cannot replace a nurse. You cannot replace the clinical judgment that comes with having a nurse who is able to look at and put their hands on and assess and evaluate a patient that's right in front of them.
I
And I think that
totally
that's something
agree.
that hospital leaders and health system leaders need to be aware of as well.
Yes, please.
I totally agree with what Jacqueline said, and I see it where the fear is coming from. And it's mostly about the AI making decisions for human, or the removing humans' judgment, like what Jacqueline said. And I believe one of the most important things about decision making with AI is that it should assist nurses and clinicians or humans in other fields, not make decisions for them. And I'm a strong advocate for the idea that decisions should be made by a human who can interact with you. Are the patients here, and understand aspects of your situation that a computer might miss. And nurses are the perfect personnel here, right? You provide bedside nursing to your patients. You understand what's going on. You know the preferences and the health conditions of the patients, and you know the context of the caregiving, right? And at the same time, we need to remember that humans can get easily tired, while a computer doesn't get fatigued or distracted by its surroundings. So I think that's why it's essential for humans and AI or computer systems to work together, complementing each other's strengths to provide the best care possible, while preserving the human connection or human touch that's vital to the patient and provider relationship.
Yeah, absolutely. And actually, that's a great segue to a statistic that I wanted to share that we have on hand. In a 2024 study of ER nurses by Backholm et al., nurses were found to spend the most time on charting in the EHR, so 27% of their time, compared to 25% on direct patient care. So, to your point, Jane, there is obviously a disconnect when it comes to the amount of time we're spending caring for the patient versus charting, where a computer or natural systems of data or AI that can make it easier would lessen that time. So, as nurses, I think it is important to remember that there are very huge benefits to be able to accepting these processes simply by eliminating the time that it takes to chart, or by being able to look at trends and prepare patients better and have just overall better care, to Jacqueline's point of what she was saying. So, although there can be a misunderstanding, there is overall a much more beneficial way that data and AI can be used in our everyday care as nurses.
Yeah, for sure. And I think that also just speaks to the need for nurses to be involved in the design of these products from their inception, right? And that sort of intersection between clinical care and sort of computer science, data, technology, all of these folks who are working on developing these tools, thinking about, well, what would it actually be that would help nurses reduce their documentation burden? Because those of us who are not on the clinical side and in a patient facing role every day, we may not know, what is it that you really need to reduce your time spent documenting so that you can spend more time communicating with and caring for patients. And in what ways can we maybe feasibly reduce some of that burden with some of these tools?
Yeah, I mean, I think that's really, at the end of the day, what every nurse wishes for is more time with the patient. So being able to use these tools and resources to our advantage will be what helps with that ultimately. I do kind of want to switch gears a tad because I'm sure there are students who are listening, especially with our partnership with Emory. And because, like we have mentioned, there are so many facets of nursing and there's diverse ways you can be a nurse, including what both of you do with data science. I am curious about kind of the nitty gritty of the career path and what that looks like in terms of your work life balance or your career satisfaction or even pay. And this is for people who are either curious about getting into the data science field as a nurse or are currently in it and maybe want to become more advanced leaders in this area. So I would love to know both of your experiences and either just, your job satisfaction overall and making that switch from what you were doing before, because I think this is a very pertinent area that a lot of people can start considering in their career.
In terms of nursing informatics, I want to just put this out there as a job option or career options for nursing students. There are a lot of nursing informaticist positions at different hospitals and health systems, and they are aggressively recruiting people, nurses, into these positions. So once you graduate from your bachelor's of nursing science, there will be an opportunity to get a master's degree or doctor of nursing practice or DNP degree in these areas. And you can get easily tap into these positions. And you can be a big part of the decision making related to the clinical information systems in a healthcare setting. And as community-based informatics researcher, I really love my job in terms of generating the data and generating the evidence to improve older adults' care. And I like technology, all about technology. And especially these days, I'm more interested in finding ways to improve technology adoption and promote the use of technology if the technology is proven to be effective. And one of my research participant groups is community dwelling older adults, especially those who are from low-income communities. And there's a high interest in these technologies among these people, and they'd like to learn about technology and they'd like to use technology for their health. And it's exciting, but there's a lack of support, lack of training. And those are some key barriers to the adoption of technology or sustained use of technology in these communities. So I find my passion in these areas these days to how to encourage them to be a user or proficient user or competent user so that they can feel confidence in managing their health using any type of technology that's available to them, or how to introduce this novel technology related knowledge and information so that they don't feel any fear or tackle the distrust in any technology companies or technology solutions, or how to advocate for their voices that's not being heard frequently in the research world and in the clinical field. So those are some of the areas that I'm passionate about these days. So that makes me sometimes overwhelmed, but I would say I'm so proud of my work, and whenever I interact with my students or research staff, I share this passion and enthusiasm with them so that they can feel the purpose of doing this type of research with community dwelling folks.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
And Jacqueline, what about you? What would you say when it comes to starting or even getting into this field? What would you give advice for people that are, or students rather, and non-students? Maybe you're a nurse who is looking to change your career. What would be the best way to even get involved into being a data science nurse?
Yeah, I think that there are so many different options depending on maybe what your interest is, what sort of ways that you want to kind of apply your skills, whether or not you want to still be actively at the bedside or involved in patient care, whether you want to be someone who's more like Jane or me and being on sort of the research side of things. So my journey was I actually went directly from, well, not directly because I worked in between, but I went from a bachelor's, a BSN program to working for a little while and then went back directly into a PhD program. So I skipped the master's track kind of entirely because I knew that I really wanted to be a researcher. I knew I wanted to be sort of in the driver's seat and using these large data sets, whether it's Medicare data or EHR data, to answer questions that I cared about. And I love that. I love having sort of the flexibility and the ability to ask the kind of questions that I feel really passionate about. And one thing I will add, and then I'll get into some of the other ways that people at really any stage, whether you're a student or currently practicing nurse, can kind of go into this. I will add too that I think one of the things that might be a little bit scary about going into whether it's a PhD program or even pursuing an informatics career with a master's degree or whatever it is that you might choose. I think a lot of nurses are very skeptical of statistics. And I feel that. I believe it or not, I am that person. I was that person. I was never, a super strong math person in high school and growing up. And it was something that when I was in grad school, kind of slowly and with the support and camaraderie of my fellow cohorts, was able to get to a point where I understood enough of like basic statistics to communicate with the statisticians and the uh, modelers and computer scientists that I work with to be able to say, okay, this is what I'm trying to do. I want to see how this nursing care model is associated with, let's say, reduced readmissions, because I look at that a lot with my work in Medicare. And I want to be able to say that this is what's impacting changes in readmissions or patient outcomes, controlling for all of these other community level, patient level, health system level factors. And they can kind of work with me in doing that. And so it really is sort of a team-based effort, which is, I think, another really great thing about, as nurses, we are used to working in teams all the time. And I think it just shows why it's so important to have nurses being involved in these conversations and in the driver's seat, if you will. But I'll also say, to get back to your original question, Raquel, that whether you're a student, no matter what kind of degree program you're in, there are so many opportunities. And even if this is just something that you're like listening to and you're like, you know what, I kind of want to just learn a little bit more about this. If you're a bachelor student or a master student or wherever you are in your journey, go to a professor or to an instructor or teacher that you trust and say, hey, I think I might be interested in learning a little bit more about data science and informatics and nursing. Is there someone I can just talk to about what this would look like? There may be opportunities. I know one of the things that I did as a bachelor student was get involved as a research assistant in different kinds of projects that sort of led me to my current path. And that was something that I feel like was very well received. And I had support when I would just reach out and say, hey, I think I'm interested in getting involved in this, and asking for that support, because we need these people. And I think that if someone as an instructor were to hear of a student's interest, they would be like, yes, we need that, please. Like, let's find something for you. At least I hope that would be the response. And I think that's something that you can do if you're in a bachelor's program, a doctoral, a master's, wherever you are in your journey. I think that that's something that's a valuable skill that you can bring to your clinical practice. If you are a nurse practicing at the bedside, a lot of hospitals or health systems will have sort of what's called a nurse scientist. I know we have one here at Emory. Other institutions that I've been a part of have at least one where you may have a person who sort of is either at the hospital or has sort of a dual role with a hospital and a local nursing school. And a lot of times, these nurse scientists, part of their job is to work with nurses who are interested in developing and understanding scientific questions. So if you've got this really nagging research interest, or not even research interest, but this nagging question, or, why is it that the patients with this diagnosis tend to maybe get readmitted even so much, even if they're not quite as sick? Or let's say, why is it that, how can we maybe predict people who are at risk for developing sepsis or developing a central line infection? How can we kind of prevent that? Because this has been a huge problem. If that's something that you're interested in, see if there is a nurse scientist at your hospital. Your manager, your supervisor may know, and just see if you can schedule an appointment and just say, I just want to learn a little bit more about this and see if this is a career path that is right for me. A lot of places now are starting to implement different programs for nurses who are interested in informatics or data science. I know Emory has one where nurses can apply for a fellowship to use data that has actually been transformed already from Emory's EHR into a usable format so that nurses can answer clinical questions. It's called Project Now. It's really such a cool opportunity and something I wish I had at the start of my career. There's so many different ways that you can get involved or even just learn a little bit more just by asking. And someone always knows someone, and hopefully someone will be able to point you in that direction.
Probably there are some people out there who might be wondering how to get started, right? If you are curious about what AI is or what data science is, and I can share my experience with the audience. So as the informatics researcher, I needed to learn some advanced AI techniques that my engineering colleague was going to use. And I heard some about it from my colleague, but it's still, there is some lack of knowledge myself. So I went to some online course platforms like Coursera or LinkedIn Learning, and they provide a lot of great resources. Even some of the courses are just 10 minutes, 15 minutes, or 1 hour, and they cater to learners at various levels, like very big beginner or to intermediate. So you can choose whatever that works for you. And I guess it would be a really great starting point to get to know about the basic concept and what are the methods to use. And it will give you some sense that data analytics or AI or big data is not that scary as you thought. And this is something that you can have as one of your skill sets.
What would you say to someone who maybe isn't very confident about their skills when it comes to technology? Maybe they feel they're not very tech savvy, but are curious about this type of work. Is it something that they should still pursue? Do you have to have like a basic knowledge of tech, or is this really something you can kind of learn along the way?
Well, one thing that I say to people all the time is do not let my age fool you. I like spiritually am an 80-year-old woman with no knowledge of tech, and my ideal night on like a weekend is to sit at home with my dogs and do a
Love
crossword
it.
puzzle. So I definitely am that person who kind of came in and was not really super tech savvy. Definitely was not the first person to, and I'm still not the first person to like jump on new technologies. And I was very skeptical of Chat
Yeah.
GPT at
Same.
first, and I still am, but I've gotten more comfortable with it. But I would just say that I am sort of a living example that you don't have to be the most like tech savvy or uh, tech kind of forward thinking person who knows about all of these different things already to get into this field. If you are interested in solving the problems that you see in your clinical role on sort of a system level, you can find way like you will learn the technology and the tools kind of come along, but thinking of the question and thinking of the problem that you want to solve, that's really where I would recommend nurses to start, because someone else knows the tech, someone else knows the software and the algorithms and all the things to kind of build the models that you want. But what they don't know is the problems that you as the end user are kind of facing on a day-to-day basis, and how to make the tech products that they're developing more suitable to your kind of day-to-day needs and to your patients' needs, really. Uh, so I would say, don't let that be a barrier if this is something that you're interested in. If you don't already have this like foundational knowledge of statistics or technology or software, because there are other people that do. And I know for me, finding people who have skills that maybe I don't have and working with those people has been essential for my career. And I think that for a lot of nurses, that's true. And I would also say you probably know more than you think you do, especially if you are a nurse. You're already using so many different transforming forms of technology and adjusting and adapting to them. So give yourself more credit.
Give yourself that grace. If you're curious about it, might as well see if you like it and take some courses and see.
And you can talk to the tech savvy people that's around, who are around you, right? So in my example, I have collaborators from engineering schools or computer science, as I said earlier. And I realized that I used to have conversations many, many times with them to develop a proposal that's utilizing some type of technology or AI algorithms. And always I ask them a lot of questions, and I start with my questions by saying that I'm going to ask you some dumb questions. Please don't judge me. And they are welcome any type of questions. And that's the kind of way of learning about what they do and what we can do as a group to collaborate with on a certain project. So yeah, don't have any fear about asking dumb questions. And those are not actually dumb questions,
Yes.
actually.
No question is a dumb question if you're asking. So I did kind of, on topic of what we're talking about with career and also resources, Jane, you had mentioned a few that were really helpful for nurses that are in like an entrepreneurial space or have a nurse-led business. What would either of you say, or how do you think that data can be used to help with clinical solutions and development for business when it comes to nursing? Because there are quite a few amazing ones popping up, a lot of entrepreneurs out there with innovative ideas, and I'm sure data can play a role in helping them as well. I don't know if either of you can or would like to speak on that.
Yeah, I mean, one thing I can speak on is a lot of what I do may not be specific to a product, but is really around sort of how care is structured, right? So the model of care that's happening in, for me, a lot of time it's primary care or community health centers. Sometimes it's also in hospitals. I think this trend that we're seeing of virtual nursing kind of going live in many different hospitals is a really good example of that. That's a whole separate conversation. But if you are sort of in that innovative space, there are probably a ton of uses in terms of whether you're doing a cost effective analysis to see, how can I scale up the development of this product in a way that is feasible for my business without sacrificing quality. It can be working with sort of your customers or your vendor platforms to kind of collect data on how your product is faring in those settings. It can be really in all sorts of ways, thinking about taking the data that many entrepreneurs, I would imagine, already have on hand and thinking about how can I gain insights from this data on how my product was performing in a much more comprehensive way, and sort of thinking about the whole as being greater than the sum of all the parts, right? So you might have data on how many, let's say, customers you had that used this product and how that did, and how sort of you did financially, and another customer that maybe you had that, let's say, didn't do as well, and maybe you didn't get as many of those financial rewards from that. Why does your product work in some scenarios or for some customers more so than for others? What are some of those differences between the places or the customers that you're selling to say, like, okay, here's how I can maybe adapt this product to better fit the needs of this customer versus the, contexts are so different, and maybe a product might be really needed in one space, but let's say if you're in a really rural area, let's say, and you're working on something related to, let's say, like remote monitoring, because I know that's a big thing right now. Let's say that, you have a product that's all about, here's how we can monitor patients when they're discharged from the hospital and they go home, and we can see sort of how they're doing and intervene in real time if they start to decline. If you're not in an area where, let's say, Wi-Fi is really stable, is there a way that maybe this can be done via telephone? What are the ways that you can adapt your product to meet the needs of different customers? I think that's really sort of the application of data analytics in a way, or data science in a way, that, again, is sort of the whole being greater than the sum of its parts. Does that make
That
sense?
does. And I really like that metaphor of the whole being greater than the sum of its parts. I'm just, as I'm listening to both of you, I'm realizing heavily how data is integrated into every aspect of what it means to be a nurse, no matter what type of nurse you are. And I didn't realize that before. I mean, you and we all had met prior to this episode to kind of discuss data. And even then I was like, wow, this really is such a massive role of the nurse's experience that I didn't take the time to consider. But there's so much more to it that I'm even learning now. So I think that's very helpful for, not only students that we've touched upon, but business leaders, bedside nurses. Clearly, data is effective in any lane that you're in. And it's just a matter of knowing how to use it to your benefit, really. At least that's my takeaway.
No, absolutely. And I will tell you, just from what I keep hearing out in the world, to say, like, I frequently hear of data scientists and computer scientists actively looking for nurses to kind of get involved in helping them think about how they develop and scale up their product that they're interested in building and the problem that they're interested in solving. And they really want nurses' insights, but so many people don't even really know, like, where to go to kind of find those nurses. And because those nurse informaticists are in such short supply, having those skills and figuring out, what your area of interest in and what innovation is happening in that space is a really strong way to kind of market yourself and think about, is this a career I want to be in long term? How can I kind of bring these skills to life and work with the people who are developing this so that it is valuable and useful in clinical care?
That's totally true. And I would say that so nurses have a wealth of knowledge and insights about clinical problems. And those are some of the things that we can bring to the table and start something innovative and creative. And that's what, like Jacqueline said, those are some of the things that can spark some innovative ideas based on these collaborations. And I think the only limitation is your imagination. So it's okay if you don't have any skill sets about data analytics or big data or AI knowledge, it's okay. But you can still make some great contributions to this field. And I recently met a nurse entrepreneur who is also a nurse educator and researcher. And she started her own company while being a professor at a university. And her company focuses on developing some smart speaker software, like some algorithms for Alexa, the Echo Dot type of speakers. And her company was based on her clinical and research experience, which is about using this voice technology to help older adults manage their symptoms more effectively. So she found some gaps in the research and in the algorithms as well. So she started her own company to build something that is necessary to make advancements in her research. So that was so inspiring story to me. So, oh, this is not something that I cannot do, right? So I have something in my mind and in my ideas, and I can start something from small. It doesn't have to be big, and you can start from there. And there is a group of people that who can help you with this process. So don't panic and just go forward and be a creator and innovator. That's what I want to talk to some students.
Yeah, that's incredible. And actually a kind of good segue into what I was going to ask you, Jane. Before when we met and talked about data, and I got a little more acclimated to both of the work that you do, you had mentioned a case study, and I hope I'm not putting you on the spot here, but a case study about machine learning and AI embedded in the EHR systems, and AI rejecting and redirecting nurses with their notes. I did kind of want to circle back when it came to the topic of AI and give you the space to tell nurses about that, and just another example of the ways that we're using data. If you would like to speak on that case study.
Yes. So recently, my friend who is an ICU nurse shared a story about her nurse colleagues. And the hospital they are currently working adopted AI system in the existing EHR. And I think that's related to some sort of nursing documentation. And while these tools are designed to streamline documentation and improve efficiency, they realize that these systems can create some challenges for nursing staff. So some of the struggles these nurses had was that these AI tools often enforce strict templates and rules for documentation, which can limit nurses' ability to capture the nuance and the context of patient care, right? And sometimes these AI-driven systems can create more work by requiring additional data entry or corrections to align with the algorithm's expectations. And nurses can feel tired of these additional requirements or additional time that they need to put. And nurses can feel the loss of autonomy, right? Because the AI systems seem to dictate what must be done or written in the nursing documentation. And nurses obviously need to constantly interact with these AI tools while managing patient care and while managing patient care, right? And they need to focus on several things at the same time, and it increases cognitive load. So those are some of the things that nurses are experiencing in some fields. I would not say it's for every field, but definitely AI systems can create these burdens and some interruptions in the clinical workflow. And that's why, as Jacqueline said previously, we need to get nurses involved in the process of designing and implementing these systems so that nurses' voices can get heard and nurses can be a can be treated as a target user, a critical target user. So they can provide what's going on and what would be a barrier to the effective use of these systems, and what created inefficiencies and how we can prevent these things so that we can provide better care for our patient. Because everybody's hope is to provide meaningful patient-centered care. And if the AI systems or whatever systems can make more hurdles for nurses or users, then why should we use them? So those are some of the things that we need to consider. And I encourage my colleague nurses share their opinions and get their voices heard, and don't afraid to be speaking up.
Thank you for sharing that, Jane. I do have one more question before we go into like an open forum of final thoughts, but we have mentioned quite a bit about advocacy and getting involved in leadership. And I'm wondering, for people that are listening and do have that motivation and want, what are the first steps to actually implementing advocacy and leadership when it comes to the field of data, for this to be something that more nurses are aware of and making change in?
So I guess we need both top-down and bottom-to-top approaches. So staff nurses needs to know what's going on in their workplace and at an organizational level, and they can make contributions by suggesting to their bosses that I'd like to be in this committee or in this task force. I want to provide my inputs about the important things that we are trying to implement here. And also at the same time, nurse leaders and managers have a role here, so they can see what's going on in the nurses' everyday lives and can have some information sessions with them or some informal interviews to see what's going on in their daily lives, and invite many nurses into these important roles and responsibilities, so that nurses' input can be reflected on an important decision-making process. So that's what I'd like to suggest.
Yeah, for sure. Jane, I think you hit on a few really important points. And I think getting involved in some of those shared governance committees or hospital task force about not even necessarily data science or AI, because not all hospitals may have some of those committees just yet, although many might, but thinking about what problem it is that you want to be involved in solving. Are you, really interested in understanding how we can potentially identify those who are at risk of sepsis? Are you interested in understanding how we can detect individuals with certain types of cancer earlier? All of these things have tools and have technologies that have been built and are actively being built now to kind of work on some of these problems. And so thinking about what clinical problem is it that you're really interested in solving, and what might a hypothetical solution be that maybe involves technology or data science in some way. Maybe that's as simple as understanding the extent of the problem and seeing, are there studies that have been done that show to what extent this problem exists? And, that's even one way of, at the most basic level, thinking about, what data science can do is just helping you identify the scope of your clinical problem. Thinking about mentorship, right? Is there, again, a nurse scientist or a nurse informaticist at your hospital or at your institution that you can kind of reach out to and just say, hey, I'm really interested in what you're doing, and I have this clinical problem that I'm really, interested in digging into. I'd love to chat about some ways in which we could potentially look into this and how data science might be applicable to this. Thinking about what that could look like, whether that's a person at your hospital, a professor, or someone in your orbit who may be able to help walk you through some of those basic stages. I know Jane alluded to this earlier, but there's lots of even YouTube videos that you can look at for free that can tell you anything about, whatever clinical problem of interest, what tools may be out there that could potentially aid in addressing some of these and thinking about, is that something that you would want to be a part of? And what, is this tool something that you could see as being helpful? Or are you looking at, oh my gosh, the way that this tool is being developed and is being advertised would make no difference in my clinical practice. I wouldn't use that. That seems so time consuming. So thinking about like what is already out there and even just looking online for what some of those solutions to your problem of interest might be. And then again, just talking to your manager or your supervisor and thinking about how can you get involved in some of this work at the hospital level or at your institutional level. A lot of times, maybe there are local or national conferences. I know more and more are thinking of ways to incorporate nursing innovation and nurse-led technologies and datathons and hackathons. Would your employer be willing to sponsor you to go to one of these conferences and bring back that knowledge to your unit or to your institution and think about how can we look into these things? That's a really great way of developing professionally that doesn't even, doesn't require you going back to school or signing up to get another degree. That just is like thinking about how this might be used in your day-to-day life, and how you can make those connections and start to get involved in this world and think about what that career path might look like for you.
Yeah. I love those resources and suggestions. I think those are all incredible ways to get involved. And hopefully, for anyone listening, you will follow those if you're feeling interested in doing so and make the world of nursing a more well rounded place for all of us to be involved in. I did want to open it up for some last final thoughts, maybe words of wisdom or things that we didn't talk about for either of you to touch on before we close it out.
I would just say to especially nursing students or early career nurses who might be listening, who might be interested but may not necessarily know what their exact question is or their exact problem of interest or even how they would begin to think about growing in this role, that it's okay if your career doesn't look like everyone else's or even anyone else's. I know when I first left the bedside and went back to school to get my PhD, I got looked at like I had 10 heads and people were like, "What are you even going to do in that? Like, what do you even want?" And I'm like, "Well, I want to fix these problems that we're seeing at the system level and get involved in developing evidence that leads to good policy changes and thinking about how we can incorporate that." And if you have, whatever that passion is or whatever that thing is that just kind of makes you light up or gives you that sort of itch to solve that issue, go and follow that. Don't be afraid to ask. The worst thing that someone can tell you is no. Uh, it's okay if you don't get it right the first time or two, and hang in there and just think of all of the different potential options in which you could maybe take this career if you're interested in pursuing this, whether that means going back and pursuing a certificate or another degree or just getting involved at the hospital level or unit level or institution level in addressing some of these problems. So hang in there. I know a lot of the times from our perspective, it seems like we had it all figured out the whole time. No one has it all figured out. So don't be afraid to just dip a toe in and see if it's right for you.
I love that. And no one has it all figured out. That is for sure.
I still don't have it
No,
figured out.
definitely not. Jane, any last thoughts from you?
I would just add one sentence here. So it's actually the title of seminar paper written by two visionary leaders in nursing informatics, doctors Patricia Brennan and Susan Bakken. And the title is Nursing Needs Big Data and Big Data Needs Nursing. So this highlights the vital synergy between nursing and big data. And as we talked many times here, the nurses generate vast amounts of critical data from patient care observations to documentation in EHR systems. And these are the key to advancing healthcare analytics. So what we are doing as nurses is not a small thing. It's not trivial. And we are contributing a lot to the healthcare. And yeah, so we need them and they need us. So here we are.
I love that. That's a wonderful way to close. We need them and they need us. Well, thank you both so much for joining. And if you're listening, make sure to check out Emory University, Nurse.org. Share this episode if you enjoyed it. Let us know your thoughts. And we'll see you next time.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.